Good morning, everyone. My name is Robert Hersey. Happy Wednesday to each of you, and on behalf of FATA, welcome to today's webinar titled Individual Placement and Supported Employment. This webinar is being made available through a collaboration between the Florida Department of Children and Families and FATA. Please note that as an attendee, you are in listen-only mode and are only able to view your name. Your webcam and microphone have been disabled. If you have questions, please send them using the chat panel. We will answer questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio at any time during today's presentation, there are a few options to try using the audio connection panel. For computer audio, click the up arrow next to unmute, then click the switch audio connection button. Click disconnect. Click the up arrow and switch audio connection buttons again, then click call in using computer and follow the instructions. If you continue to experience poor audio through your computer, try using the I will call in option. The access code and event password will be posted in the chat panel momentarily. You must be connected to the audio of this presentation as well as view it on screen to receive a statement of credit. We are unable to verify attendance if you are not connected to WebEx via your computer or the mobile app. Therefore, phone call only attendees are not eligible for a statement of credit or CEUs. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording in PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through FATA. A statement of credit and CEUs for up to 2 continuing education credits are available for participating in today's webinar. CEUs are available for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, Mental Health Counseling, and for persons credentialed through the Florida Certification Board. Completing the evaluation is necessary to receive CEUs or a statement of credit. Please note that the evaluation will close at the end of the day on Monday, November 3rd, 2025. To complete the evaluation, you will first need to register or sign in to your account on the FATA website. Information you provide FATA as part of registering remains confidential. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you are licensed outside the state of Florida or certified by the Florida Certification Board, you do not need to provide your license number when registering with our site. If you need assistance with account registration, login information, or accessing the evaluation, please fill out a contact form on our website or email training@floridabha.org before November 3rd, 2025. Please note that WebEx monitors the arrival and departure times of attendees and provides a report upon completion of the event. We are not permitted to provide a statement of credit if you do not attend the entire webinar, and we are not permitted to provide partial CEUs. Statements of credit and CEUs will be posted within 30 business days after the evaluation closes. This presentation is intended solely for educational purposes. The views, opinions, information, and content expressed in the presentation are those of the presenter and do not necessarily reflect the views, opinions, or policies of the state of Florida, the Florida Department of Children and Families, FATA, or the Florida Behavioral Health Association. Attendees should note that sessions are recorded and published in various media. Our presenter today will be Sarah Swanson. Sarah brings over 30 years of experience as a rehabilitation practitioner and individual placement and support trainer, and currently serves as the director of the IPS Employment Center at the Research Foundation for Mental Hygiene, Incorporated, a nationally and internationally recognized leader in IPS training and resources. She spent 17 years working in mental health agencies as an employment specialist, care manager, and director of rehabilitation services before serving as a statewide IPS trainer in Ohio, and later as a national and international trainer for more than 14 years. Sarah has consulted with agencies and governments around the world on IPS implementation and expansion, contributed to multiple studies, co-authored a manual for IPS specialists, and developed online training courses and other IPS materials. In her current role, she facilitates a large IPS learning community spanning 29 states and 7 countries, provides guidance on IPS implementation in non-traditional settings, and has developed toolkits and resources for SAMHSA. And now I would like to welcome our presenter, Sarah Swanson. Sarah, I will turn it over to you.
Okay, thank you. I'm going to pull up my PowerPoint here, if I can figure out how to do that. Okay. So it was nice to see all the greetings on the slide. You seem like a friendly bunch. And I'm looking forward to, even though I can't talk to you, I'm looking forward to hearing your comments and questions in the chat. I usually speak quite a lot with the people in the audience, and I want to hear about your experiences and what you think works and what concerns you have about IPS. And so I would just love it if you put comments and questions in the chat throughout the presentation, and I will try to answer or respond to those as they come up. Thank you for the good mornings. So as we just heard, I work for the IPS Employment Center, and I've done employment work for all of my career. I was an employment specialist in a supported employment program, and then a supervisor of a supported employment program, and then I was an IPS trainer in Ohio. And this is what I really love. This is what I have a deep passion for. And I guess that many of you feel the same way if you're here today. So during this presentation, we're going to talk about randomized controlled trials, which is the evidence for IPS supported employment. The reason that it is an evidence-based practice is that there's been a lot of research evidence for IPS. I'm going to describe the 3 pillars of IPS and the 8 practice principles to give you a feeling of what the practice is like. And then I'm going to go through some IPS program implementation strategies for those of you who are interested. And if the place that you work doesn't have IPS, I hope that you'll consider using some of the IPS practice principles anyhow, because we know that the closer programs follow the practice principles, the better the outcomes they'll have. So an overview of what we're going to talk about today is that IPS is an evidence-based practice. It was originally developed to help individuals with serious mental illnesses who wanted to work, and it has been widely adopted across North America, Europe, Australasia, Japan, Taiwan, and other Asian countries. It has a fidelity scale, but can also be described by 8 practice principles. A fidelity scale is something that helps programs figure out where they map onto the IPS approach and where they don't. So it has items in it, and as an example, one item is caseload size. And to get this highest score of 5, caseload sizes would be below 20, or 20 or below. And a score of 4 is also good fidelity, and that would mean caseload sizes of 25 and below. And the reason that that item is in the fidelity scale is because that when they did research studies, employment specialists who had 30 clients or even more really didn't have great employment outcomes because they, as the employment specialist said, they felt like they were spinning their wheels trying to keep up with everyone, and that didn't give them enough time to really help people get into jobs. So there are 25 items, and they can all be scored, and you can download this fidelity scale at our website if you're interested in seeing it. The website is on the last slide of this presentation, but it's ipsworks at .org, ipsworks.org. And if you go into the library on our website, you can find the fidelity scale. One other thing that we're going to cover today is recent and future trends for IPS that include IPS for young adults specifically, disabilities beyond mental illnesses that may benefit from IPS. Right now, they're promising practices, but not evidence-based. So we think that it would likely help people with other disabilities, but we don't know for sure until more research is done. And then also supported education to help with career goals. There hasn't been any good research on supported education. It's a hard topic to research because research grants are usually about 2 years long. 18 months to 2 years is how long people are typically in the research condition. And that's not enough time to see if people manage to graduate from their programs, especially if they're going to school or training on a part-time basis. So that's sort of been a holdup, but we're really hoping that some researchers will pick this up and help us learn more about how to provide effective supported education. Just before we get going, I want to mention that this model was created by Debbie Becker and Bob Drake, and they published A Working Life in 1993, which is when I think IPS really hit the public or hit the mental health scene. And the story of it all is that Bob Drake was a psychiatrist at a mental health agency in New Hampshire, and Debbie Becker worked for him. I don't know exactly what her title was, but she worked for him and she was helping different people get jobs just because she thought it was important for people to work. And one day, Bob went to pick up his son at a ski hill. And while he was waiting for his son, one of his clients swished over to him and said, "Hi, Dr. Drake." And, he was very animated and chatting. And he explained, "Well, now that I'm working, I can afford to go skiing again, which I really love." And Bob was so impressed at the difference in this person. Seeing him animated and talkative was not the person he had known in the past. And so the next day he went into the office and he went straight to Debbie's desk and started asking her what she did to help people find work. And he wanted to learn more about what she was doing. And then together over time, the two of them developed the IPS practice principles and the first version of the IPS, the Supported Employment Fidelity Scale. So those are the co-creators. They also developed the IPS Employment Center and the IPS Learning Community. Debbie recently retired, and Bob is still around somewhat.
You.
Okay, thanks for helping. We can go to the next slide. So the first question when you think about supported employment or IPS is do um, people who have disabilities and are unemployed, would they prefer to work? And the answer is yes, that people with disabilities are as likely to want to work as people who don't have disabilities. And so the low employment rate is not due to a lack of interest or different preferences, but it's about barriers and access to employment. So you can see this little bar graph shows that's around 78, I think it's 76% of the non-disabled population is employed. Well, only 40% of people with mental health disabilities are employed. And actually, if you look at people with serious mental illness, the number drops even lower to about 20%. And that may not all be competitive employment. I think some surveys include people who have non-competitive employment that was created just for people with disabilities. But what almost everybody says is they want a regular job like everyone else, because one of the reasons people want to go to work is to feel like they're part of their community again and feel like they're back on track with the goals they had before they got sick. So that's a huge disparity. If you think about for people with serious mental illness, around 20% employment, 80% unemployment. We should be viewing this as a crisis. It should really be troubling people. But I think we've all become complacent with a very low percentage of people working. Um, and, when they've done survey after survey and asked people with serious mental illness if they wanted to work, 60% consistently have said that yes, they want to work, but they don't have a job. And that is really troubling. I think, within that 60%, you might feel like, well, that's not true where we are. But actually, I think some of the people who say yes are thinking, yes, I'd like to work, but I don't know how I'd get to work. Or yes, I'd like to work, but I can't find a job I'd like. Or I want to work, but I'm afraid of losing my benefits. And these are all barriers we can help people with, so we ought to. I saw a question flash up in the chat. Do you see it? It was on my screen for a second. Do you see it, Robert? Maybe not. Somebody said a lot of people want to work but have
Yes.
legal histories.
Sorry. We have a lot of clients with disabilities or people who do not get SSI, but they have criminal charges or are not guilty by reason of insanity, and it's like there are no resources for them.
Oh, okay. Um, well, I'll talk about that a little later in the presentation then. I don't think I put slides in here about that, but I can definitely talk about it when we talk about building relationships with employers, and it'll make more sense to you if I talk about it then. So thanks for your question. And if I forget, please remind me. We can go to the next slide. Okay, so here we go. Over 60% of people with serious mental illness want to work, but less than 20% are employed. And this is a slide that Gary Bond put together. He is a researcher. And we'll go to the next slide. So we've got a poll question for you. What is special about randomized controlled trials, also called RCTs? They're a type of research study. And do you know why RCTs are so important? Should I give everyone a few minutes to answer?
Yes, feel free to put the letter of your choice in the chat. We'll give it about 30 seconds for people to answer.
Here comes some answers. The brave people are putting in their answers.
Okay, so it looks like a lot of people are seeing F, but I'm seeing a lot of E's as well. Maybe not quite 50-50, but maybe a good 70-30.
Okay. Well, thanks for everyone who answered the poll. I am shocked that you guys are so knowledgeable about this, actually. That's not usually the case. But the answer is F, and E is pretty close. Those of you who said E were really pretty close. So A, randomized controlled trials, control for confounding factors. So when people are asked if they would like to be part of a trial, they're told you may get the experimental condition, which in this case would be IPS services, or you may get the control condition, which for IPS is whatever employment services are available in that town or agency that people think are good employment services. That would be the comparison group. And we tell people, it'll be like a flip of the coin, whether you get one or the other. It'll be by pure chance. And that's how people are assigned to the research groups. They also demonstrate that in this case, IPS is the cause of better employment outcomes. So that's one thing that qualitative research, like interviewing people, which is so important. We need to know how people feel about the services they get and what they would prefer their services to be. But they don't sift out whether or not IPS was the cause of the better outcomes. C is not true for randomized controlled trials, but it is true for most of the randomized controlled trials that have been done on IPS, that they occur in real life settings, not in universities, even if university staff are the investigators. And D, they're the gold standard in medical research. So the answer is A, B, and D. But people who guessed A and B are on the right track for sure. I'm really impressed about that. So we'll move on to the next slide. So I'm going to share a little bit about the research for IPS, not too much. And before I did that, I want to explain that some of these slides were written by Gary Bond, who is a professor he was a professor at Purdue University in Indiana and Dartmouth in New Hampshire. But he spent most of his career researching mental health programs for people with serious mental illness, and he did a lot of work on ACT, assertive community treatment, and then later in his career really focused more on IPS supported employment. So just to credit his slides, you may see Bond at the bottom of some of these slides. We can move on. So we're going to talk about the study characteristics of 28 randomized controlled trials of IPS for people with serious mental illness. And that is a large number of studies. But we recently learned that there are 2 more studies that we should add to these slides. So that will be 30. And, Gary Bond always used to tell me that's more research studies for IPS than there is for a lot of the prescription medication you take. It's just an overload of research studies. And this slide here shows some characteristics of those research studies. So on the left, you see who is the first author, usually the primary investigator. The second column is the study location site. So you see Washington, D.C., Baltimore, Maryland, Hartford, Connecticut, a bunch of rural sites, Montreal, Quebec, 6 cities in Europe, Hong Kong, Australia, Hong Kong again, London, San Diego. You'll see that these studies are done all over the place. And the control conditions are whatever other employment services were available in that location. So it could be a skills training program that was supposed to lead to competitive employment, enhanced vocational rehabilitation, which was to help people get back to work in the community, psychosocial rehab programs, a sheltered workshop that was convinced that they were helping people get back into the competitive work, and all different types of variations of different types of employment programs. The next column is the months of follow-up. So when someone enters the study, how long do we watch for whether or not they work? And you can see that most of these are for 18 months or 24 months, but there's one down towards the middle that had 60 months or 5 years, which is really unusual. And that was done by Helger Hoffman in Switzerland. And we learned a lot about IPS from that study. It really helped to have a longer term study. So you can read these more carefully when you look at the PowerPoint later. And we'll go to the next slide. So this shows the same randomized controlled trials in a bar graph. And the red bars indicate the number of people who obtained employment through IPS services, and the orange bars indicate the percent of people who became employed through the control programs. So whatever employment program was available in that location. And you can see that IPS outperformed the control groups all the way across, although there were some differences in how successful IPS was. In the study on the far right, That was done in Maryland, and they didn't ask people whether or not they wanted to work before they entered the study. And then the one just to the left of that, Layman, was a study that was done where the programs did not have good fidelity to IPS. So some people questioned, was this really IPS you were studying? But we don't know for sure. It's possible that those are not the reasons they had lower outcomes. So that's why we include them in the slide. Does anyone have a question about the last couple slides we went through?
I see no questions at the moment, but I did want to highlight, Sarah, that I did copy the website for more of Gary Bond's research into the chat. So if anybody's interested in doing some more research than what is on these couple slides, you can visit that link.
Oh, great. Okay. So that would be the contributors to that link are probably Gary Bond. Also, Bob Drake has done a lot of research. And also, a new researcher for IPS is Anna Florence. She might have contributed something there. She's currently doing a research study for people with autism spectrum disorder. And we're really excited to see how that goes because adults with autism in the US virtually have no access to employment services. And nobody studied what would be most helpful. And so we really would like to help that group of people. So we're trying to figure out, does IPS work for that group of people? Does IPS need to be adjusted a little bit? We'll find out more after her study ends. So we can go ahead and move to the next slide. So overall, out of these 28 randomized controlled trials, in the US, about 61% of people obtain employment, and about 27% in the control groups obtained employment. Outside of the US, which would be mainly Europe and also Australia, New Zealand, a little bit of Canada, outside of the US, 51% of people obtained employment and 23% in the control groups obtained employment. There have been a lot of people trying to understand why the outcomes are lower outside of the US. And some people think that it's possible that in Europe you get a contract when you become employed. It's like you might get a 3-month or a 6-month or a 12-month contract with your employer saying that you're employed for that time period. And it's not as easy to fire people as it is in the US. So they think maybe they think maybe employers are nervous about hiring people with disabilities because they they know that they're going to be employing that person for a while. So that could be one explanation. Another could be that, and those employers are wrong, by the way, but another possible explanation is that in a lot of European countries, disability benefits are really good and people have nice apartments, they can get washer dryers. And so it's possible that people are more reticent to risk losing benefits. But I also think that, I've worked with some of the European countries, and when I visit them, and also when I just talk to people from those countries and look at outcomes for different programs, there are always some programs that kind of stand out with better outcomes. And when I ask, why do you think that program is doing so well? Almost hands down, the trainer will say, because those employment specialists go out into the community to meet with employers, and the other programs don't. And so that hasn't been studied, but I would be very surprised if that was not part of the reason that the employment outcomes were a little lower outside the US. So what we really care about, since we live in the US, are the outcomes in the US. So people are 2 to 3 times more likely to obtain employment than they would be if they went to a different type of employment program. We can go to the next slide. So a meta-analysis of research studies have shown, so this is when a researcher would look up all the studies they could find about IPS to see, some of those studies will have looked at one or more factors that interest the researcher, and then they try to, gain an understanding by looking at all of those studies about the factor they're interested in. So compared to the control participants, IPS participants were 3 times more likely to work. They gained employment faster, usually it would say twice as fast. They maintained employment 4 times longer during the follow-up period. So after they were out of the research study, they kept their jobs 4 times longer. And they were 3 times more likely to work 20 hours or more per week. So in addition to just looking at whether or not people obtained employment, it looked like there were other factors that favored IPS. Maintaining employment is obviously one of the most important ones, and working more than 20 hours per week is also very important. And we can go to the next slide. So non-vocational outcomes, people always want to know about the non-vocational outcomes. And, the story I started out telling you about Bob Drake going to the ski hill and seeing that his client was doing so much better is an example of how people will often tell stories about how people look brighter and more interested in the world and uh, have a stronger affect when they become employed. But what we know is that IPS does not consistently improve mental health or quality of life on its own. It does for some people. It does improve mental health for some people, even sometimes just while they're working. So some people will say, I don't hear as many voices while I'm working. Does anyone have a guess as to why that might be? You could put it in the chat. Or some people say I'm not as depressed when I'm working. I remember when I was an employment specialist, I helped a woman named Margarita get a job as a hostess. And after she worked for a year, they gave her a week of paid vacation. And after a few days, she called her boss and asked if she could come back early. And she said, when I'm at work, I put on my uniform. I I put on my uniform and I greet customers and I have to kind of fake it. And she said, after I fake being cheerful for a little bit, I start actually feeling cheerful. And the interpersonal contact is really helpful for me. And that's why she wanted to go back to work early. So it helped her with her depression to get out of the house and be around people. And someone saying integration versus isolation. A lot of people said um, employment can help with mental health symptoms because when people are busy, their natural endorphins kick in, feeling good that I'm doing it good at work. Yeah, almost everybody says that IPS helps with self-esteem. Um, and lots of reasons, just being distracted during the time that you're working, being distracted from your symptoms. I think that happens for all of us, whether or not we have a serious mental illness. When you're going through work is my only source of socializing, depending on individual social self-esteem. Yeah, you guys get it. And when any of us is going through a hard time in our life, that's often when we want to be at work, so we can have a distraction from what's going wrong in our personal life and take a little breather until work is over and we go back to um, dealing with issues in our personal life. Um, so IPS helps by getting people into jobs, which then helps with these outcomes. So you see the non-competitive outcomes, self-esteem, 80% of people said they had better self-esteem. Around 38% of people reported fewer symptoms, and around 15% of people reported better life satisfaction. And I'll talk about this a little bit later, but one thing we know is that when people get jobs related to their preferences, that does usually improve the quality of their life. But if we help people get jobs that are not related to their preferences, that does not improve the quality of their life. And so, even though some people may not have worked for a long time or might have legal histories, and the temptation might be, take this job, it's a starter job, it'll get you going. The truth is that people, uh, that doesn't necessarily help people because it doesn't improve the quality of their life. And then sometimes people will drop out of employment because they don't like those jobs. And you may not be able to get the person the exact job they want, but you can talk to them about, why is it you want to work at NASA? What is it about NASA that interests you? And you might find out more about the person's interests and help them think of a different job that they would like. And that's very important. So we can move on to the next slide. Oh, okay. So we're done with the research slides. And this is just to show you the IPS learning community. So these are the different states on the left that have joined the learning community. We have Alaska, a lot of states in the Midwest. We really want to get Hawaii because we would love to visit Hawaii, but not yet. New Zealand and Australia are implementing IPS, and Spain, France, Netherlands, England, Italy. I feel like I'm forgetting someone. Montreal, Quebec. Um, Pretty sure I'm forgetting someone. But in any case, oh, the Canary Islands, which are part of Spain, just joined. So that was kind of neat. So we hope more people will join the learning community over time. And we think we have some people who might be interested in joining now. And what the learning community is it's a way for different states and countries to talk about how they fund IPS and to try to figure out better methods for offering funding for the services, more sustainable funding. They talk about problems like turnover in IPS. No, the clubhouse model is not IPS services. There are a few clubhouses that are implementing IPS within their services, which is kind of neat, but they need to break a few clubhouse rules to do that. So, for example, the work order day, the employment specialists need to not participate in the work order day. They need to be free to be out running around the community, talking to employers, seeing their clients. And so some clubhouses don't want to break that rule, and other ones say it's okay if the employment specialists are released from the work order day. And there also have to be special attempts at integrating IPS with mental health services, which some clubhouses have figured out and others struggle with. So, Clubhouse International in itself is not IPS, but there are some clubhouses who are implementing IPS. Um, so in any case, these different states and countries also share what is working. For example, a trainer in Kansas was really interested in this sales technique called conceptual marketing. And he went to training on conceptual marketing in California and came back with these fancy, complicated ideas, which were actually good. They were just so hard to understand. And so we boiled them down to something simple that I'll talk about later. And we actually saw employment outcomes improve across the United States when we did that. So we learn from different people in different states, and we learn from people in the field all the time. Um, our trainers often go out in the field and work side by side with people, helping them contact employers or meeting the people they're serving, talking to mental health treatment teams. And they'll sometimes see something that seems to be working and come back and talk about it. And then we'll all talk about it and try to figure out, is it possible for other programs to do this as well? And then the goal is eventually to have the researchers research that strategy to see if it really is effective. Okay, so that's what a learning community is all about. And Broward County, Florida is part of the learning community, but the rest of Florida has not joined yet. We hope you do someday. So we can go to the next slide. So now to start talking about what is IPS. IPS is typically a program that operates within a mental health agency or a substance use disorder treatment agency. Sometimes it's in a FQHC, a federally qualified healthcare center. Um, yeah, you can get a copy of the presentation. I'm going to send a slightly altered one to Robert, and it's fine with me if he shares it with everyone. So IPS is typically a program within a mental health agency or substance use treatment agency. And part of the reason is that we want to collaborate with the treatment staff to make sure everyone is supporting the person with their employment goals and that they are helping us understand what the person might enjoy and what they like. Excuse me. But it isn't always within a mental health agency or substance use treatment center. Sometimes the employment program is in a separate employment agency, and then they need to make arrangements to integrate services with a local mental health center. The IPS unit consists of at least two IPS specialists, two full-time IPS specialists who report to a single supervisor. So that's the team. And the reason that we know that we specify two IPS specialists because when there's a single IPS specialist, it is harder for people. They don't have anyone to share job leads with. They don't have anyone to learn from. There's no one to say, oh, I knew a job seeker in a similar situation and this is what I did. You might want to try it. Or such and such employer has a job that he might like where he can work alone. Um, so we think it's helpful to have two full-time IPS specialists. But that being said, a lot of IPS programs start with just one IPS specialist who reports to a clinical supervisor. And in rural agencies or frontier areas, there often is just one IPS specialist because there aren't enough clients for more than one employment specialist. On the other hand, in big urban areas, there can be many employment specialists. There was a big agency in Chicago that had around 30 employment specialists. They really valued employment and they served a lot of people. So agencies sort of have to figure out what the right fit is for them. And in the beginning, they may not have a lot of people raising their hand to say they want to go to work. But as more and more people go to work, others, unemployed people will hear about it and they'll be like, man, if Jack can work, I can work. Or it could be that a mental health practitioner who thought people couldn't work sees some people go back to work and thinks, oh, I was wrong. People can work even if they're having symptoms or even if they have substance use problems. And I'm going to start referring more people to IPS. So it might start out slow, but keep an eye on the referrals and see if they don't pick up over time and then try to adjust the staffing as you can. We'll go to the next slide. Okay. So this is a trick question too, because I haven't talked about the IPS principles yet, but we'll see who already knows. Which principle below is not consistent with IPS? Is it situational assessments where people work for a month or 3 months in a community business, but they get paid through vocational rehabilitation? They get paid a minimum wage. And the idea is to prepare people for work or to just assess whether or not they have good work behaviors like showing up on time, getting along with other people, following directions. Um, is that part of IPS? B would be competitive integrated employment is the goal. So that means just regular jobs in the community is what IPS focuses on. C is that IPS specialists use a multi-step process to build relationships with employers. They might visit employers on several occasions to build up that relationship. And D is people who want to focus on career development may be assisted with supported education. So which principle is not consistent with IPS? I'm watching the answers roll in. I'll give you a little bit more time. Okay, just 10 seconds more or so. Okay, well, thank you everyone who answered. Um, there's one more answer. The answer is A, which is what most people said. A few people said D, but situational assessments or job tryouts are not part of IPS. Any guesses about why that might be? You can put it in the chat. Or A's. Well, no one seems to want to guess. So I'll just tell you that assessments for people with serious mental illness about workplaces do not predict who's able to work, actually. And that could be because for some people, it's the environment that really matters, like having the subjective, like having the right supervisor might make a certain workplace just right for somebody. Or somebody else may need to try a few workplaces to figure out what they need in a workplace. But those situational assessments, people know they're not real jobs. And I had an employer once tell me he'd rather just hire people because when people know it's not a real job, they don't try as hard. And I think that's probably true. What is consistent with IPS is competitive integrated employment is the goal. There's a multi-step process to build employment relationships with employers. And people who want to focus on career development may be assisted with supported education. I saw quite a few Ds, and I understand the reason for that, which is that for many years we spoke about IPS as being for employment. And in the fidelity scale, there was just one little mention of helping people with ongoing education or training if they wanted that, could be part of job supports. But we didn't really focus on it. However, in the last 10 years or so, as more and more programs for young adults have cropped up, there's been more and more interest in supported education. And that's why we are putting more of a focus on it now. So great job again. And good job for everyone who took a risk on being wrong. I really appreciate that. We'll go to the next slide. So there are three IPS pillars that support the 8 principles. So these are the really most important things to know about IPS. One is it's very individualized. So I just said that competitive integrated employment is the goal. But if somebody comes to you and says, I really want to volunteer for a little bit first just to get my feet wet, and then I'll look for a paid job, you might say, okay, I wouldn't expect if I visited your program, I wouldn't expect to see more than 2 or 3 people engaged in volunteer work because when you offer people paid work, they usually want the paid work, which I understand completely because I definitely work for pay. Um, but the idea is that some people are not going to want exactly what we have to offer. And in those cases, we're going to make some adjustments for them. The next is that it's a team-based approach. So there's the IPS employment team that the employment specialists are helping each other out, helping with solutions or introducing each other to employers and sharing their employer relationships with each other. But it's also a team-based approach because the IPS specialist is part of the mental health treatment team, and they work closely with mental health treatment providers or substance use treatment providers. And another way that it's a team approach is that we encourage IPS specialists to ask people if they would like a family member to be involved in their employment journey and to connect with those family members with the job seeker. Um, so a lot of employment specialists tell me nobody on my caseload wants to include a family member. And then we kind of talk about, family members don't need to be a relative. They can be a good friend, a partner, whoever somebody identifies as their support person. That could be the person's family member. And a trainer in Minnesota taught me that a really good way to ask people about this is to say, if you got a job tomorrow, who's the first person you would call? And that is an excellent question. A lot of people respond to that, and they'll tell you who the first person they would call would be. And then you might say, well, it sounds like you really know that person well and they know you well. Would you, should we get together with that person to sort of talk about what might be a good job match for you? What job you might enjoy and what job would really accentuate your strengths? And then follow through with that. Talking to family members, whether they're biological family members or not, is incredibly helpful, even when the family members don't agree with the person's goal of going back to work. Most people make decisions about employment within the context of their family. They don't just on their own decide to go back to work. Some people do, but most don't. And if you think about your own life, you probably make a lot of decisions about employment or other big changes in your life by talking about the people talking about that change with people who are important to you before you make the change. So if somebody wants to work and their family, whoever that is not in agreement that they should go back to work, that can be really troublesome for the person. And that's a really good reason to have a family meeting. And what you can do in that family meeting is not try to convince the family member that the person should work, but just help the client express why they want to work to their family member, why it's important for them. And you don't have to change anybody's mind, especially not in the first meeting, but you could describe how you're going to try to support the person. You can't guarantee that things will work out, but you can describe how you'll help the person. And you can also just being there to meet the family face to face will help them start to develop trust in you. And that may help them feel more comfortable with the person going back to work. And they can share their concerns. They might be worried about the person losing benefits, in which case you might refer the person and the family member to go to benefits planning together, or they might have other concerns that they can talk to you about. But when family members are concerned, you might think about having a few family meetings, just so family members, if they feel listened to, if all you do is listen to them, things will be on a better footing for your client because people generally really appreciate being listened to. If you think it's going to be a very fraught meeting, you might consider taking your supervisor or a colleague with you. Like you might take um, uh, a counselor or a therapist, you might meet with them and the family and your client. But most of the time, I think it's just people who love your client might have concerns. And so you want to give them an opportunity to share those. So that's another way that we use a team-based approach. Just consider that family members were there before you came along, and they're going to be there after you leave to support the person after the person's out of IPS services. And so they love this person, they want to do the best for them, even if it seems like some of the things they're doing are not helpful. You can help them think about what might be more helpful and just respect the fact that they've supported the person in the past and that may not have been easy. Finally, it's a team-based approach because IPS works best when the person has an open case at vocational rehabilitation. So the VR counselors we think are really helpful, not just because they can help people buy steel-toed boots or work clothing or something else, bus passes, but because the vocational counselors often know a lot about different kinds of jobs. When I started as an employment specialist, I was working in an industrial county, and I didn't know what a metal grinder was. I didn't know what a packer was. I didn't know what assembly worker was. I didn't know there were differences in those job titles. And it was really a VR counselor who helped me understand some of those differences. And then also visiting the workplaces and seeing people work helped me a lot too. But VR counselors might know about specific workplaces in the county. I remember sitting in one meeting with an IPS team, and the VR counselor was there, and they were talking about going to Lowe's to look for employment. And the counselor was like, well, don't go to Lowe's on Main Street. Go to the Lowe's out at Westgate Mall because the one on Main Street, is they have a bad track record and how they treat people, blah, blah, blah. And I thought that's the kind of long-term knowledge that's just really helpful. Um, Also, they know about different disabilities. Another, I'll tell on myself again, story about being a new employment specialist was I was helping someone get a job in an industrial laundry. And the VR counselor was like, Sarah, what are you thinking about? He's got asthma. He's not going to be able to breathe in a laundry and because of all the steam. And I just didn't know that. And so it's really helpful to have someone who does know things like that to be part of the team in thinking about what would be a good job fit. The last principle, and I know I've talked on and on at this point, the last principle is community-based services. So IPS specialists spend at least 65% of their time, their work hours, out of the office. They may be at meeting people at libraries, at coffee shops. Young people might want to meet at a park or a mall. or at their high school. They might meet people at the vocational rehabilitation office, and we're going to count that as the community, or workforce center, that's fine too. They may be taking people to job interviews. They may be meeting people at their workplaces with their employer to talk about how things are going, but they're out of the office a lot. If somebody works 40 hours a week, that would be a little over 5 hours a day that the IPS specialist is out of the office. And since the pandemic, people have been more reluctant to work in the community. Some specialists have. Um, but I'll just tell you, when I was an employment specialist, that was one of the things I really liked best about the job. I couldn't understand how people could stand to have office jobs. It just sounded so boring to me. And I was out driving around, meeting people in different businesses, learning about businesses I never would have known about, meeting new clients, meeting their families. It was just interesting. And I remember one day specifically, it was a early spring day, warm day, and I was driving around with the window down and my radio cranked up, and I thought, this is the best job in the world, because it just felt so good to be out and about. In the winter, I had a problem because I never had dry feet, but so it's not roses every day, but for the most part, I loved working out and about. And that is a really important principle because, if you don't take IPS to people, a lot of people won't engage in IPS. They'll just drop out of the labor force. And you might feel like, well, if they really want to work, they should come in and show that they can show up in time for appointments. But the truth is, a lot of people, oh, someone else loves field work. A lot of people don't feel that hopeful about getting a job. Even if they sign up for IPS services, they may be thinking, well, we'll see what happens because they haven't had luck with employment services before, or they've had trouble holding jobs. And if you don't feel that hopeful about employment, you may not want to jump on a bus to go see an employment specialist to look for a job. Everyone hates, not ever, most people hate job searches because, the rejection. You usually get turned down for jobs before you get offered one. And so it's not true that people who don't show up to your office won't show up for work. A lot of people who seem like they're not very motivated get a job, and all of a sudden you see all this motivation and people do show up for work. Um, so you want to take the program out to the people where they are. And then it also makes a lot of sense to me because why would you meet with people in the office when IPS is about helping people integrate into their community? The jobs are out there in the community, and that's where you want to be with people too. I remember one time visiting a client who I used to see him at the center all the time. And one day I went to visit him at his apartment. We were going to go out job searching together. And he was chit-chatting with his girlfriend, taking out the trash. He just looked so like a totally different person to me. And I think it's because I wasn't seeing him as a client. And that really was an eye-opener for me. And it helped me understand um, that people do have more to their lives than being a client. And that's the way to learn about people's strengths is to be out of the office with them. So I suppose I've said enough about community-based services. If anyone has any questions or comments, they can throw that in the chat, but otherwise we'll move forward. Okay, so strengths-based, sanitized office environment is anxiety producing. I think that's true. That can be. I never like going to the doctor, and I think it's partly because or the dentist for that matter. And it's partly because I hate going into those clinical environments. And I bet other people feel that way too. So, what does it mean to use a strengths-based approach? Does it mean that IPS specialists should try to avoid thinking about possible problems? Does it mean that people without strengths are not eligible for IPS? Does it mean that IPS specialists focus on a person's strengths because is what will help them succeed? Or does it mean that IPS specialists make a list of their own strengths that they can use to help the people they serve? Some answers are coming in. Everybody, feel free to give it your best go. We'll give it just another 5 or 10 seconds. I love all the answers. That's so great that people are answering. And pretty much, I think I've seen the answer C, which is correct. So we don't avoid thinking about possible problems. In fact, we think about the person's past job experiences in part to help us try to find the person the right job fit. So if a person has had trouble in busy, noisy environments in the past, we might think about helping them get a job in a quiet environment. But we also look at people's work history because we want to know what could trip the person up. If there's some condition that we can't avoid, what could trip the person up? Because as though, even though people want us to focus on their strengths, they also don't want to repeat past bad experiences. So we're going to think about their work history, think about what symptoms or substance use are currently present, if at all, and how that might affect working. Think about the person's supports and how that can help them with work. Um, yeah, people need to know about their Medicare or Medicaid to make sure they hang on to medical benefits if that's what they want to do. But then we're going to focus on their strengths because the way all of us succeed at work is by focusing on our strengths. Like I'm not really very good at math or science and numbers in general. I'm not very good at. So I just sort of unconsciously picked a profession that didn't rely on a lot of numbers and doing math. And I bet that's how a lot of people find their jobs, is they just intuitively know what their strengths are and what they want to stay away from. And that's why we're going to help people focus on their strengths. And also because some people might want a job, but they may not feel confident that they'll ever find the job they want or that anyone will want to hire them, especially if they've had a long gap in their work history or they have legal problems in their work history. They may feel like they're never going to find a job. And so we focus on their strengths in part to let them know that they do have skills that an employer would value, or they have personal attributes that an employer would value, such as honesty or being reliable. And so I think it's helpful to point out people's strengths. You know, you can ask them what they think their strengths are, but and you can also point out what strengths you've observed that will help that person with employment. Um, D is not the answer, but it's not a bad idea. You can make a list of your own strengths that you can use to help the people you serve, and I think that would be a helpful thing to do. So, um, let's see. Let's take a 5-minute break and then we'll come back and finish up. So let's come back at 9 past the hour. Thanks. Good answer, Suzanne and Christine. You got it, Ahmed. That was the right answer. Same for everyone is putting in the right answer. Good job. The meeting is taking a quick break. We'll be back at 11:09. Yeah, sure. Okay, I see it's 11:09. Um, if Robert's ready, I'm ready to get going again. Thanks. Okay, so I think I already explained the pillars, but I'll just say the services are based on individual preferences, which are really important, strengths, lessons learned from previous work and educational experiences. You might want to ask people what went well for you on that job. What didn't you like? How'd you get along with your coworkers? What was your boss like? Those are the interesting questions, more so than how many, the dates you worked or what your job duties were. You want to find out what the person learned about themselves as a worker. Factors related to their disability, whether symptoms or some mental health symptoms or substance abuse, their living situation, who supports them. Do they have a legal background that you need to think about? Do they have a military background that you want to highlight? Um, so spending time to get to know each other actually, and getting to know the job seeker well, you might use something called a career profile. If you look on our website, ipsworks.org, go in the library, you can search for the career profile, and it's sort of a long document, but that's what we use when we're starting to get to know people over the first few weeks. And we try to just spend some time chatting with people, letting the conversation go where it will, and maybe taking a few notes, but not asking people question after question because it's a long document and I think people would get tired of it. I was working with a young adult a few years ago just because I wanted the experience, and I would try to do the career profile with him. But even though, I mean, it took me forever to work on the career profile because he wasn't really interested in talking about it. So I know sometimes it can be hard. We'll go to the next slide. Um, so the team-based approach, as I mentioned before, there's the vocational unit, which is basically the IPS specialist and supervisor, the mental health treatment or SUD, substance use disorder treatment team, the family and other support people, the state vocational rehabilitation counselor. I've heard that it's a little hard to become a community rehab provider, CRP, also called a vendor for VR in Florida, but I think it's well worth it. I really recommend doing it, not only because you can get so much help from those VR counselors and thinking about good ideas for the person, but also because you don't want to rely on just one source of funding, because if something happens to that source of funding, what's going to happen to your program? You want to try to have different sources of funding for the program. And if you are a vendor, then VR can, for example, authorize job placement for a specific person. And when that person gets a job, you can bill VR for it. So it's another way to support your program. Working with VR is good in multiple ways, I would say. And we'll go to the next slide. Okay. And the last pillar was about community-based services. People spend 65% of their working hours away from their office. They meet people at homes, libraries, workplaces, businesses, the family home, schools or certificate training programs, parks, coffee shops, malls, workforce centers, VR offices, or other places that a person likes to go. There was one young person, when you're working with young people, it's a good idea to give them lots of control. And so this specialist was asking the person, well, where would you like to meet? And the person thought for a minute and said, well, you can meet me on the bus on my way to work. So I don't have to spend extra time meeting with you, but I'll be on the bus anyhow. And so the poor employment specialist had to go catch the bus and get on with the person. And then they would spend time talking on the way to the workplace. And then when they got to the workplace, the employment specialist would get off, cross the street, and take the bus back to wherever her car was. And I just give her a lot of credit for doing that. Okay, we'll go to the next slide. Okay, so now we're going to pile on the 8 principles on top of those pillars, and we'll go through them one by one. And we can go to the next slide. Zero exclusion criteria. So this means who's eligible for IPS services. And people are not denied IPS services based on any of the following. They can have psychotic symptoms or any kind of mental health symptoms. If they want to work, they're eligible for IPS. If they choose not to take medication regularly or even at all, in spite of symptoms, they are still eligible for IPS. If they have an active substance use disorder, which means they might be using drugs or alcohol, in spite of it being really bad for them, they're still eligible for IPS. Lack of housing, missed appointments doesn't predict who will work. Someone might need to work on their personal presentation or have legal system involvement. They're still all eligible for IPS. And the reason for that is that when they did the research studies, when they started doing them, the researchers thought they would be able to predict who could work and who didn't. So, for example, they thought people who had active substance use disorders would not be able to work. But actually, people with substance use, drug and alcohol problems were as likely to get back to work as people without those problems. And the same for all these other issues. In terms of personal presentation, one of my favorite stories was Debbie Becker told me, one of the co-creators, about a guy who had terrible hygiene and grooming, and everyone talked to him about his hygiene and grooming and said, you've got to clean up to get a job, and he didn't want to listen to any of them. So Debbie or someone who worked with her helped him find a job in the city dump because she thought, what difference will it make if he smells when he goes to work or looks dirty? He's working in the dump, it won't matter, which was true until the first day when he went into the lunchroom and was sitting down with the other people he worked with. And one of the guys turned to him and said, "Damn it, Daniel, you stink." And that was when he started taking showers and wearing clean clothes because he didn't care what all these mother hen case managers were saying to him, but he did care about what the guys at work were saying to him. So sometimes the cart goes before the horse, and that's just the way it's got to be. Um, Another story I could tell you about zero exclusion criteria was when I was an IPS specialist, and there was this one client named Chris who was always causing trouble. And when his name came up in mental health treatment team meetings, everyone would kind of groan and be like, oh, what's he done now? He would stand up and be shouting in the waiting room, intimidating other people. Just, he was a lot. And one day he stopped me in the hallway and he said, "Are you the job lady?" And my heart just sunk because I thought, how am I going to get Chris a job or help him keep a job? But I knew about zero exclusion criteria. So I said, yes, I'm the job lady. And it turned out, Chris did have a lot going on in his life. He was always psychotic. He believed that he was Jesus Christ and he had saved the world. And he sometimes had visual hallucinations. He did drugs and alcohol on a regular basis, used them on a regular basis. He had a lot of interpersonal conflicts. He had trouble hanging on to housing, but he wanted to work. And that was like the one positive thing we'd heard from Chris in a long time. So I managed, his big preference was that he wanted the job to be within walking distance of his apartment. He didn't want to take a bus, and he wanted to work part-time so he could keep his benefits. And so I helped him find a job that was in walking distance. He was working in a diner back in the kitchen. And um, he he used to stop in my office sometimes or call me and say, you know, do, do I really have to go to work today? And his point was, he saved the world. Did he really need to go work in a diner? And I would just say, your boss is counting on you. And then you could see how proud he was of that. And he would go to work. He just wanted to hear me say that his boss counted on him, that somebody counted on him. I think he was kind of fishing for that. And it was amazing to see him work. He worked for quite a while. And one of the supports I offered was I knew that when he got paid, he would be tempted to use more drugs and alcohol. So I knew when his payday was and what time he got off work. And when he got off work, I would just be sitting outside the diner in my car. And I'd say, "Hey, Chris, do you want to go shopping?" And he'd say yes. So we'd go deposit his work check and then we'd go to Super Kmart. And what amazed me was he went straight to the girls' dresses and started holding up little dresses and say, "Which one do you think my daughter would like, this one or that one?" And it was just so opposite of the picture I had of Chris in my mind. But he did have a daughter that he really cared about and wanted to contribute to to her and give her things if he could. And it was so sweet. And sometimes he bought her school supplies or other things, and sometimes he bought things for himself. But we tried to spend down that paycheck as much as we could so that he wouldn't be tempted to use more drugs and alcohol. And he was able to manage that. And the other kind of lucky thing that happened was that um, there was an older woman who worked in the kitchen in the diner, and she really liked Chris. She got to know him and really liked him. Or she might have known his mother, who was well known around town. His mother was just the nicest person. And in any case, she really cared about Chris, and that made him feel good about going to work. In fact, she used to tell him to show up 15 minutes early, and she'd cook him breakfast and feed him before before he started work. Um, and those happy coincidences happen more than you would imagine they do. Um, so I think those were some of the reasons that work worked out for him, and also just because he was so proud of himself for doing something positive. And what happened was that when his name started coming up in the mental health treatment team meetings, instead of people groaning and asking, "What has Chris done now?" they were like eager to hear what Chris is up to because everybody was so excited about him working. And it totally changed their relationship with Chris. It changed my relationship with Chris. And I think it just made things better in a lot of ways. So even though I was really nervous about working with Chris, he totally changed my mind about zero exclusion. So we can go to the next slide and talk about the next principle. The next is that job seekers' preferences are important. So preferences could be about the type of work. I mentioned for Chris, it was the number, how much he earned, so he wouldn't lose Social Security, and also that he wanted to be able to walk to work. That's not uncommon desire from people. Um, Another preference could be working alone or working with people, the time of day a person works. When I started out, I was a student and at an ACT program, and I was the employment specialist. And there was a man named Tom who drank every night until he fell kind of passed out, fell asleep. And then the next morning, he'd be in pretty bad shape. He also had schizophrenia, and he was pretty paranoid around other people. And my supervisor at this internship asked me to help him find a part-time job, and I helped him find a job where he took the bus to work. And by the time he got to work, he was so nervous about going into work that he couldn't get off the bus. He just rode it home again. And so she said, help him find a job close to home. So I helped him find a job close to home, but there were a lot of pretty young women working there. And I think he had a crush on one of those women. And every time she was around, he just couldn't concentrate. He just fell apart. And so that job didn't work out. So she said, help him find a job close to home without any pretty young women about. But we knew that he needed good supervision, but not right next to him because that made him very nervous if he thought the boss was watching every move he made. So there were all these criteria about what Tom needed in a job. And it sort of seemed like this guy's never going to find a job that works for him, but he did. It took a few jobs like maybe 5 jobs before he found the right job. But he worked there for years, and it was a part-time job in the evening cleaning a bank after the offices were closed. So he's mostly alone, but there was a supervisor in the building somewhere. There weren't any pretty young women just by chance who worked there, so that was not a problem. And he could walk to work. And for him, preferences were really about transportation and feeling comfortable on the job. And what Tom showed us is that first of all, I'm just amazed that he was persistent and hung in there for that job. All those different job, I mean, for losing a job is hard, but he hung in there and kept wanting to work. And the other thing we learned is that, being really individualized with people and sometimes learning about them from their work experiences is how you help people find the right job. We know that people keep their jobs twice as long as if at least three of their preferences are met. So that sounds very challenging, but if you think about the time it takes to help someone find a job, it seems worth putting in the extra effort so that they'll keep the job twice as long. And also, the most important reason to follow client preferences are that employment increases the quality of people's lives only if they enjoy their lives. I live in Cleveland, and there was a man who wanted to work at NASA, and all his case managers just kept ignoring that because seemed so unrealistic. Um, and then he got a new case manager who referred him to IPS, thinking, I don't know what they're going to do, but just referred him. And it turned out what he really wanted to do was just do anything at NASA so that he didn't have to be an astronaut. He just wanted to do anything so he could, because he loved the space program and wanted to work in it. And he got a job finally as doing data entry at NASA, and he was pleased as punch. So for him, it was the type of job which is going to be true for other people too. We can move on. If anyone has a story about job preferences being important, please put it in the chat. So, what is an ABLE account? A program that allows family members to put money aside in a trust for a loved one with a disability, an online program to help people make a catalog of their strengths, a savings program for people who have means-tested benefits such as housing subsidies or Social Security income, a program that helps young people put money aside for education. And one of these is not an ABLE account, and the other three are. So which one of these is not consistent with an ABLE account? A bad question. Here, C. Is that, Ebony, are you saying that's not what is consistent with ABLE, or that is what is consistent with ABLE? Okay, lots of B's. So people know about ABLE. Ebony, I'm sorry that question was wrong. The wrong question. It should have been what is not consistent with an ABLE account. So I think I steered you wrong. But most people knew that A is true. It allows family members to put money aside in a trust for a loved one with disability. And C is a savings program for people who have means-tested benefits, such as housing subsidies or Social Security income. So, and it's a program that helps young people or any people put aside money for education. So, ABLE is called Achieving a Better Life Experience. And you can read more about it at able.com. It's a new program that is really exciting because it used to be that when people went back to work, if they had SSI and a housing subsidy, they would come out ahead, but not by very much. But now with these ABLE accounts, people can put part of their paycheck into the ABLE account, and their rent won't go up as much and their SSI check won't go down as much. Um, and people can put money aside for education, for a car. They can put it aside for fines to get back their driver's license. They can put it back for anything that would help them achieve a better life experience. They can gym memberships so they can be in shape to go back to work. It's a very generous program. And you can look at the ABLE program in Florida. And if you don't like it, the person can open an ABLE account in California or Michigan or anywhere. Different states are allow different things, but it doesn't matter where you live. You can open an account anywhere. It's a really nice program for people to be able to save money in spite of having means tested benefits instead of just being stuck without being able to save for a car or new furniture or whatever people want. It's very generous in terms of what people can get. And starting in January, it used to be that people needed to be diagnosed before the age of 26 to be eligible for ABLE. But in January, people just need to be diagnosed or of a disability with a disability before the age of 46, which almost everyone with a serious mental health is diagnosed before the age of 46. So most of your clients will be eligible for ABLE. And I hope you take a look and educate people about ABLE accounts because I think they're really a way for people to get ahead and try new things. So we'll move ahead to the next question or the next slide. So here we are talking about benefits planning. So we want people to understand how their entitlements will be affected by a return to work by someone who is training in that area. When I worked in the field, I used to get the Social Security Red Book. It used to get mailed out in hard copy, actually. Now it's just online. But we used to just go through the Social Security Red Book with people, but that's really incomplete because most people don't only get SSD. They also often have housing subsidies or some sort of retirement benefits, or they may have a dependent child who depends on their benefits, in which case they need to know about that. Or they may get food stamps as well as, you really need to have training to totally understand these benefit systems. So, community work incentives coordinators, also called CWICs, are people who've gone through a training program where they get tested, and it costs about $1,500 to do. People who get VR services often have access to CWICs through being a VR client, which is another reason to work with VR, so that your clients can talk to a CWIC before they go back to work. And then when they need to make decisions about changes in work, if somebody's going to accept a promotion or a pay raise, they might want to talk to their CWIC again. Um, Some people are going to need help attending those CWIC appointments because it's hard for them to go to a new place, meet with a new person, or it might be online and they might not be sure how to get online for a virtual appointment. And so you might offer to help be there for the appointment with the person, also because the benefits rules are really complex and you might be able to help the person remember what they learned. You could take notes while the person's listening. Family members might be interested in attending, so they might attend instead of you with a person. And you want to ask the CWIC for a written description of what would happen to a person's benefits if they earned 1,000 a month, if they earned 1,500 a month, what would happen to their different sources of entitlements, and what would their bottom line be to show people that they can get ahead. A CWIC can also educate people about ABLE accounts. And you might even invite a CWIC to your agency to talk to a group of clients or mental health practitioners about ABLE because that's new and they may not have heard about it yet. It's been very underutilized. So we'll go to the next slide. IPS services are integrated with mental health treatment. So IPS specialists go to weekly mental health treatment team meetings. They sit with all the counselors, therapists, case managers, and they're part of the team, not a visitor. Um, and they're there not to just update the team, but also to ask for help thinking about different situations. So it might be that someone's working and they had a relapse and started drinking again. And so they're going to talk to those team members and say, what can we do to help support this person? Should I ask for time off? Can he come back to group? What would help him get back on the wagon? Or what do you think would be a good job match for this person? You know him better than I do. And what do you think would be meaningful work for him, or really what would excite him about going back to work? In the best case scenario, the IPS specialists have their office space with the mental health team that they work with so that they see each other off and on throughout the days, not just at a weekly meeting, and they can catch up about what's going on with people during that time. And also, so they can just work together. Like it may be that someone needs rides to work for the first week or two, and the IPS specialist may not be able to cover every day, so they might ask a case manager to cover a few days. They have shared documentation, so there's one client record that the IPS specialist has access to, so they can see if there's a medication change or if something else is happening with a person. And the case managers and psychiatrists and everybody can see what's going on with a person's job goal. And also, this team works together on engaging people in IPS services and re-engaging people. A lot of people will kind of come to IPS and stick, it's like they're sticking their toe in the water, and they'll be there for a month or two and then they'll drop out, and then they'll come back to IPS services for a little longer period, and then they'll drop out, and then they might come back a third time, and this time they get a job. So we want to keep reaching out to people who've expressed interest in work and try to understand what got in their way. Was it confidence? Was it not feeling hopeful? Was it family demands or something else? Um, that's okay, Laura. So we want to try to engage people who drop out. And helping people with work really requires a team. Everybody supporting that person, just helping them maintain motivation, just saying, I think it's so great that you're working. You know, one thing I've noticed about you since you've been working is you have a lot more to talk about. I've noticed that you go see your family more often. Is that because you're working and you can talk about your job, or, you know, you just you smile more than you used to smile, and just encouraging people to keep working. So we can go to the next slide. So I'm beating this one to death, but IPS specialists also collaborate with state vocational rehabilitation counselors. It's good if the programs are vendors for VR and they talk together. You know, I was with one program and they were trying to find a job for someone. And I said, you know, we'll call Jeff. That was the VR counselor. And they're like, this guy doesn't have an open case with Jeff. I was like, you know what? Just call him anyway. Jeff always has good ideas. And so they called Jeff and they said, this person isn't your client, but can you help us think about a good job idea? And sure enough, Jeff did. So I just knowing VR counselors can be helpful. And also working with families to talk about good job matches or good job supports, not to discuss clinical issues. So some people might be nervous about having a family meeting because in the past, the family meetings have focused on problems like he's not taking his meds or he's drinking or whatever. And what you can explain to people is this is not to talk about problems. This is to talk about what jobs could be a good match for you, what job supports would be helpful to you. And if your parents bring up drinking or anything else, I'll try to remind them that we're really here just to talk about jobs today. And I think that helps people feel more comfortable with involving families. So we'll move on to the next slide. True or false? A rapid job search means that a job seeker will find employment within 1 month of entering the program. We'll give everyone about 30 seconds to answer true or false. Well, you guys are awfully smart. F is not one of the options, but more power to you. Oh, F is for false, I guess. Well, most of you have it right. It's false. A rapid job search just means that within about 30 days of entering an IPS program, which means you meeting with an IPS specialist for the first time, within about 30 days, the IPS specialist or the job seeker or both of them together have face-to-face contact with an employer about a job. And the reason for that is that in a lot of employment programs that didn't work for people, there was a long wait before the job search started, before like actually having contact with employers started. And that's why a lot of people drop out. They just sort of give up hope that this is going to work. So you want to help people meet hiring managers right away, and we'll talk about how to do that. Um, and we'll go to the next slide. But people are more likely to get a job if you do a rapid job search. So the rationale is get started while the person is still interested, demonstrate that the focus is on competitive jobs and not changing the person. I mean, if you think about that guy who had poor grooming and hygiene, there was they had tried for years to change him and they weren't successful. And changing people is really hard. A lot of times, what you do instead is find a job who can accommodate them, that can accommodate them as they are. I remember helping a guy who barely spoke. Like, I'd have an hour-long meeting with him and he'd say about 5 or 6 words. And so I met with somebody in the schools and said, this guy wants a cleaning job and he's a good cleaner. He'll be reliable, but he doesn't speak. But if you can handle having a janitor who doesn't speak, he's your man. And that's really what it took. And in the interview, he didn't speak either. But I did a lot of the talking. And so just helping people find the right job because that guy was not going to talk. In-person contact with a hiring manager, that is the number one predictor of who gets jobs, is who has in-person contact with hiring managers. And on occasion, if a person's not ready for the job search, you might help them contact employers for career exploration. It could be for informational interviewing to learn about different jobs, or it could be to go to a workplace and watch people working in different jobs, or even to go to a community college to talk to an advisor to find out what kinds of programs are there that are related to the person's interests. That's fine too. We'll go to the next slide. Competitive integrated employment is the goal. I think we already talked about that. So these are regular jobs that anyone can apply for, regardless of whether or not they have a disability. They're not just made up for people who have disabilities or set aside for people with disabilities. The jobs pay minimum wage or above. With self-employment, the wages might start lower because that's common for most small business owners. But otherwise, the jobs pay minimum wage or above, and the person makes as much as his peers. So if I'm doing assembly and I'm from an IPS program, I would make as much as Joe standing next to me doing assembly, and that might be more than minimum wage. Working as a peer specialist is fine, even though that job is set aside for people who have mental illness. It's more the case that having experienced a mental illness is a requirement for the job. Just like being an IPS specialist, there may be a requirement that you have a certain level of education or a certain type of experience. And then job carving, identifying some duties that a client can do and assigning other duties to coworkers is an accommodation. And those are competitive jobs, even though there's an accommodation. Um, I worked with a guy who heard voices all the time, and I got him a job at Bob Evans where he was bussing tables, and he was so distracted by the busy, noisy environment. He was taking people's plates while they were still eating, and that was really making people mad. So his boss called me and said, "I'm afraid I'm going to have to fire John." And I said, wait a minute, I'll be right there." And I drove to Bob Evans and sat down with the boss and said, "What's the matter exactly?" And he was telling me, and I said, John loves working here. And as far as I know, he's never missed a day. And the boss said, "Well, that's true." And it turned out that John, who had been in the military, called his boss sir. And the boss really liked that. And so he said, I said, "Couldn't you find him some job duties that aren't in the front of house?" And so the boss made a job for him that was all in the back of the house, picking up the parking lot, cleaning the bathrooms, working in the kitchen, doing stuff. And because he recognized that John was a good worker, he just was in the wrong job. So he made those accommodations. And that was a competitive job because it was, um, you know, when I worked for Debbie Becker, she was always trying to figure out what I really enjoyed doing. And she tried to give me as many of those assignments as she could. And she did the same for my coworkers. And I feel like that's just something a smart boss does when they can. And that's what the smart boss at Bob Evans did. So we'll go to the next slide. Okay, so this is a biggie. So IPS specialists build relationships with employers. And we recommend sort of a three-step process to do that. The first is a quick visit to the business to introduce yourself and schedule a 20-minute appointment. The second is attending that 20-minute appointment to learn about the business and learn about the manager's hiring preferences, not to talk about your program, not to talk about a job seeker, but to be a good listener, which employers love, by the way. And then you might return to talk about a good job seeker who would be a good match for the business, or to continue building the relationship. We'll go to the next slide. Oh, nope, we better go back. Um, so just to describe those a little bit more, the quick visit to introduce yourself and schedule a 20-minute appointment just takes a few minutes, and it really works best in person, even though you might feel nervous about doing it. And you want to have your script ready. So you might say, "Hi, my name is Sarah Swanson. I'm an employment specialist who works at the Nord Center right here in town, and I help people get back to work. But I'm not here to find a job for anyone today. And that's because one of the exciting parts of my job is learning about local businesses and the types of people they would like to hire. I hope to schedule a 20-minute appointment with you to come back and learn about your business." And the important parts of that statement are, I'm not looking for a job for anyone today. Well, I identified myself and where I worked, first of all. And then I said, I'm not looking for a job for anyone today. And that's when employers kind of relax because they're all ready to tell you they don't have any openings, whether or not they do. But if you start by saying, I'm not looking for a job for anyone today, they kind of relax. And then I explain that I just want to learn about their business and I want to be a resource to them by helping them find the right people to hire, not just anyone to hire. Then I would go back for that appointment and I would have a bunch of questions ready to learn about the job and to learn about the business. So I might ask the employer, what goals do you have for your department? Um, when you're interviewing candidates, what personal qualities do you look for? Who would be successful at the front desk? What would they enjoy about that job? And what has been challenging for people who work at the front desk? When you're interviewing candidates, how do you find out if they have excellent customer service skills? What questions do you ask to find that out? And you'll be surprised at the number of employers who tell you the questions they ask. And so you're just trying to learn as much as you can about the business. What is a typical day like for someone who works at the front desk? What kind of experience do you look for when you're hiring front desk workers? What jobs do you have that I may not know about already? Um, and you want to have 5 or 6 of those good questions to get the conversation going. And then after that, the employer will likely just keep talking and talking, and you can ask follow-up questions. So about 20 minutes, and you are the learner in the situation. You're not educating them about your program, although if they ask questions, you'll answer them and wait to find out if they want to know more. But for the most part, I found employers are not very curious about the program. They really want to talk about their own issues, their own workplace, and what they need. Um, and so then you might go back and talk to the job seeker about what you learned. If it sounds like a good job to the person, you could you could help them fill out an application, usually online, and then wait about 3 days, which is how long it takes for the applications to get to the employer if they're not stopped from being passed to the employer. You can go back with the person's resume and say, "Hey, I was thinking about what you said. You need front desk workers who are very friendly, who are early morning risers because you have a hard time filling the early morning shift, and who are very detail oriented. And I think I do know someone like that. Can I tell you a little bit about her?" And if the employer says, "Well, I'm not hiring right now," you can say, "Well, that's okay. You told me that you sometimes have openings for the early morning positions. And maybe if you just met her for a few minutes, you would know someone who would be a good person to hire when another opening comes up." And so you're just trying to make an introduction to the employer, whether or not they're hiring, by talking about the person's strengths and then asking if you can bring the person back to meet the employer. This is a real quick and dirty on a subject that interests a lot of people. But if you go to our website, ipsworks.org, go to the library and search for employer relationships, you'll pull up a booklet that outlines this process in a lot more detail and lists a bunch of different questions you can ask employers, what you can say when you walk in the door the first time, What could be your reasons for returning to see that employer over time so you can keep the relationship warm? I really recommend that you get that booklet. I think it's called Tips for Employer Relationship Building, and it's in the library at ipsworks.org. So somebody asked at the beginning about helping people with legal histories. A while ago, we did a survey of employers. Employment specialists helped us with this. And they went out and asked employers, have you ever hired a person with a felony? And if so, why? And if not, why? And what advice do you have for employment specialists? And what advice do you have for job seekers who have legal histories? And the most important thing we learned was that employers, if a job seeker came in and they were making all sorts of excuses about, I wasn't really guilty, I borrowed my friend's jacket and it just had a crack pipe in it or whatever, they had no patience, whatsoever with that. But if somebody walked in and said, there was a time in my life when I had a problem with drugs, and as a consequence, I was hanging out with the wrong people. I have felonies for assault and for breaking and entering. But I want to tell you that I'm going to AA now. That's helping me. I'm also in counseling. I regret the things I've done in the past, and I want to keep my life moving forward. Going back to work and supporting myself is part of that. And the reason I think I'd be a good employee for you is that I've always loved cooking. I grew up cooking with my grandmother. I love working in kitchens and blah, blah, blah. So if you go to our library again and you want to learn more about this, which really actually does work, if you build a relationship with an employer and then you say, there's someone I'd like you to meet, go in with that person and have the person say, there was a time in my life when, and sometimes people are too embarrassed to bring it up. And so if you're there with a person, you can say, and there's something we want to talk to you about, right, Pete? And help Pete start telling his story and chime in when needed. There's a worksheet that helps job seekers with legal histories put together a statement that they would like to give when they meet employers and need to talk about their legal history. And there's also a summary of the survey, which is a pretty long document, and will give you a lot of details about what employers said. And I feel great about that survey because I think if you want to know how to help people with legal histories get back to work, don't ask an employment counselor, ask an employer. They're the ones who know the answer to that. And I'll just leave you with a little ray of hope, which was, let's hear your guesses. What percent of employers had actually hired a person who had a legal history or a felony history? Put your guess about the percent of employers who had hired in the chat. I'll give you 15 or 30 seconds to do that. 60%, 60%, 75, 50%, 20%, 50, 75. Ooh, we're all over the place. The actual percent was 62%. And on top of that, some employers said that they didn't know whether or not the person they hired had a criminal background because they didn't do background check. So at least 62% of employers had knowingly hired a person who had a felony, and more may have hired without knowing. So I hope you get those two documents out of our library. I think they'll be helpful. And we'll go to the next slide. We're going to skip this poll question because we're a little tight for time. And I'll just talk for a minute about job supports. Job supports are individualized. So the way you decide what job supports you're going to offer to a person is by asking them, what supports do you think will help you with this job? And you might give examples because people are like, I don't know, because they don't know what job supports are possible. So maybe give them examples and see what they like the sounds of. You might talk to their family members or the mental health treatment team. And you want to think about the person's work history. What worked for the person before and what did not work? If someone has a history of quitting a job after a few days or a week, you want to really pour on those job supports during the first week. And I would see that person in person every day they worked for the first couple weeks to try to get them past that time when they usually walk off the job. If someone's having a lot of anxiety about going to work, you might give them wake up calls to give them a little confidence boost before they go to work and to let them talk about what happened the day before. You might meet them weekly at a coffee shop to talk about the job. You try to make the job supports as convenient as possible because working people feel really busy, even if they're only working part-time. It's a big change. And they're more likely to meet you if you meet them in either convenient locations or places they like to go. Like some people really like going out for a cup of coffee or a soda. You might provide travel training to someone who has to take the bus or the train to work. That can be more than just looking at the schedules with people. You can actually get out with them before they start work and ride the train or the bus to work. You can help people obtain tools or clothing for a job, have family meetings to talk about the job, help people ask for accommodations. And another really good support, I think, is to, if you have a relationship with the employer already, the person has given you permission to talk to the employer, you might ask to schedule a 20-minute appointment with with the worker and the employer just to talk about how things are going. And the reason that is so helpful is that you want to hear about problems before the employer gets really frustrated. You want to hear about them early on. And so you might start by asking, what is Betty doing well? Just so that the employer remembers that Betty's doing some things well, and so that the worker can hear some positive things. And then you might ask, is there any area where there could be improvement? And you might do a little problem solving if there is an area, and tell the employer how you're going to help the person improve in that area. Are you going to come to work with them and watch them working for a day to figure out why they're working slowly? Are you going to help them come up with a reminder system on their phone to keep, to hustle up and work faster? Are you going to um, ask the mental health team if the person might be on a little too much medication? Could he try a slight reduction? So convey to the employer, maybe not the medication issue, but convey to the employer that you're going to be helping the person work on the issue and that you're going to come back to talk about it again. And then lastly, ask the working person, how's the job going for you? They should have their opinion valued as well. And so ask how things are going for the working person. Even when things are going well, you might want to do this once a month or so just to stay on top of things. And the employer is going to be much more likely to continue working with someone who has trouble with the job if you keep showing up at the workplace and the employer feels supported by you. They're much more likely to try accommodations. Or if things don't work out at all, they're going to be much more likely to hire another person from your program because they know that you'll be there for them, helping them navigate the situation and trying to support the worker. We can go to the next slide. Oh, helping people practice asking for raises or promotions, medication adjustment, social skills training. So the mental health team might help with some of these things. A meeting with a worker and supervisor, I mentioned that one. Help with transportation. Oh, help going through job orientation materials or learning some aspect of the job. Is one guy got a job where it was a sandwich shop that sold 50 different sandwiches, and he had to memorize all the ingredients on all the sandwiches. I would have never gotten that down, but he did, and his employment specialist helped. We'll go to the next slide. On the job coaching is used rarely, but it is used in some situations. If usually when persons have a cognitive issue and they need help actually learning their job duties, you might do some job coaching. But if the job coaching needs to go on more than a couple or a few weeks, you might consider whether or not the job is actually a good match for the person. Most of the time when I visit programs, there's no job coaching going on, and sometimes there might be for a person or two. It's pretty stigmatizing to have an employment specialist come to work with you and work alongside of you. So I think some people who are workers don't love that job support. And also, I think it's not always needed. Assistance refining personal appearance, that could be the case managers who help with that, or it could be the employment specialist. Help reporting earned income to entitlement systems is so important. You don't want people to get into an overpayment situation. And the last, career development. After people work for a while, they might have ideas about what they think would be a better job, or they might want to move on to a totally different kind of employment. And you can help with that too. You can help with supported education. So we'll move on to the next slide, which may be the end of the principles. Oh, job supports are time unlimited. So people get these job supports for as long as they want or need help from the IPS team. For a lot of people, that might be 6 months. Young people often don't want a long-term job supports. They might try to drop out before they should, in which case you might just ask them, hey, would it be okay if I just call you now and then to check in? Or offer to give them a ride to work now and then. A lot of people like that support if they take the bus. But typically, people are done with IPS after about a year of working, but it varies person by person. We want to make sure that people are really doing well in their job and they have been for a while before we close their case. And so we'll go on to the next slide. Oh, so this is one of my favorite quotes. This is a woman I met in Chicago, and she said what she liked best about working was that the way people talked about her. So she says, in the past, people may have used labels to describe me like mentally ill, welfare mom, and homeless. Now my titles are financial administrator, working mom, and student. She was very proud of herself, and she should be. I guess we're not going to have time to get to the implementation strategies. I really apologize for that. I thought I was going to run out of time, but I did the opposite, and I thought I was going to run out of slides before the time was up, but I did the opposite and ran out of time instead. So I apologize that we didn't get to the implementation strategies. I hope that the slides give you some ideas, and my email address is on the last slide. So feel free to email me if you have more questions or you want help on a specific topic, and I'll turn it back over to Robert.
Thank you, Sarah, for such wonderful information about IPS. As Sarah said, that we did not get to the implementation strategies, but I will copy the link to the PowerPoint here in just a moment so you can review those at your leisure as well. Sarah's contact information is on this slide. So if you want to copy that, or you can always email us and we can put you in contact with her if you have any questions. Everyone, please hold for just a moment for a couple of business items before we wrap up today's webinar. I'm going to post a link to the survey in the chat. I know it will disappear momentarily, so I will repaste it here in just a moment. Additionally, when I end the webinar here in just a moment, your web browser is going to populate a message that looks like this. It will say the host or presenter would like WebEx meetings to open a website on your computer. If you click continue, it will automatically redirect you to the evaluation. You must sign into your FATA account to complete the evaluation. If you do not have an account, you can register for one at no cost. You can do so by clicking haven't registered yet under the sign in menu. You must use the same email address you used when you registered for today's webinar when you set up your profile in FATA's system. This is the only way for us to connect your attendance during today's webinar with your survey completion. For CEUs to be reported to CE Broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. If you need to add or update your license number, you may do so by clicking Edit in the Professional Information section of your profile. You will get a third opportunity to complete the evaluation later today through a follow-up email. As a reminder, the evaluation will close at the end of the day on Monday, November 3rd, 2025. If you need assistance with account login, account registration, or evaluation completion, you can fill out a contact us form on our website or email training@floridabha.org. As a reminder, we do not email statements of credit. Instead, after we verify your attendance and completion of the evaluation, a statement of credit will be posted to the professional development section of your profile within 30 business days. You must have attended the entire webinar and completed the evaluation for a statement of credit. We are not permitted to provide partial credit. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access previous recordings and PowerPoints, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. Thank you everyone for participating in today's webinar. Thank you again, Sarah, for your time and the information you shared with us. We'd also like to recognize and thank the Florida Department of Children and Families for funding today's education. Have a great day, everyone, and please hold for the evaluation.
And Robert, instead of sending out that you had the presentation, I probably shouldn't have put Gary Bond's email on there. I didn't ask him. If you could remove the email from the slide with his picture, that would be great.
You got it.
Thank you. And thanks to everyone who was joined today. It was really, I appreciated all your comments and answering the poll questions.
Awesome. Thank you all so much. Everyone, have a great day.